virus, but also just about fighting disease in general, and specifically in a meatpacking plant. So they are bringing their expertise, and they've been spending the week actually touring the meatpacking plants in and near Amarillo. And they'll do that with an eye toward giving recommendations on things they can improve operationally, educationally, communications-wise, just to help keep the workforce in those packing plants safe and to slow the spread of disease from person to person there. We expect their report, they'll work on their report this weekend, and we expect for them to begin to release that information at the first of next week. Now, in addition to the CDC team that's been here working this week, we had the Texas military force that came to do testing at the Tyson plant. And they came with a group of about 80 people, and they set up a mobile testing site there at the Tyson plant. And on Wednesday, they tested 740 people. And yesterday, they tested somewhere around 1,400 people. So they are doing a high volume of testing at that mobile site with the crew that's working there. We're very grateful to have them and appreciate very much the state resources that came to set up that testing site. Now, with all of those additional tests, our positive case numbers are going to go up, but it's just showing us what's already here. And so I view that as a positive thing, because just because we don't have data showing us that the disease is moving through our community doesn't mean that it isn't moving through our community. I've learned that from Dr. Milton, and I appreciate that he continues to teach us that testing is the best way to go because it reveals what's actually here in our community. So with increased testing, we'll have better information, and with better information, we can make better strategies to fight the outbreak. We've had an emphasis this week on meeting food needs in our community. And I want to thank the partners that are involved in that, starting first with our health department employees. They are on the front lines of encountering families who have food needs, and specifically families that have gone into quarantine, sometimes unexpectedly, and sometimes without the same resources in their pantry as some of us might have. So High Plains Food Bank and Snack Pack for Kids and some local churches, as well as some of our agricultural partners, and specifically some of those in the meatpacking industry, have really stepped forward to meet food needs and to have some resources on hand so that we can continue to meet those in our community. If you are interested as a citizen about being a part of those efforts, I would just encourage you to make a donation to either Snack Pack for Kids or High Plains Food Bank, and you can trust that your resources will be well stewarded back into our community, into the hands of families that need those food resources. We do these press conferences 3 times a week so that you as citizens can be informed, and you can check on us, check on how the city is doing in the COVID-19 outbreak. But I can't help but be curious of how you're doing. And I wish I was getting an update about each one of you. And so know that you're in my thoughts, and know that while we continue to struggle and to fight against this, I do believe that it's not going to last forever. This is a temporary season, and it's challenging because we don't know if temporary means 2 months, 4 months, or 20 months, but I still choose to know and believe that it will be temporary. So thank you for tuning in to watch our updates, and know that we're willing to listen anytime you want to give us an update on you. Thank you.
Thank you, Mayor. At this time, we want to go to Casey Stoughton, Public Health Director, City of Amarillo.
Thank you, Dave. As of this morning, at 10 o'clock, there were a total of 1,411 cases of COVID-19 in Potter and Randall counties, 1,061 cases in Potter, and 349 cases in Randall County. We have a total of 220 recoveries and a total of 18 deaths reported in Potter and Randall counties. That leaves us with 1,173 active cases. Again, the number reflected on the 230 report card may be different as we have additional cases reported. I also want to thank our local community for helping us meet the need of food of hunger and food insecurity in our community. We've specifically worked with Snack Pack for Kids this week, as well as Oasis Baptist Church and St. Stephen United Methodist Church. So we appreciate them very much. And then this morning we received a very generous donation from Potter County. The Potter County judge and the Sheriff's Department brought a donation of food and gift cards. And so we really appreciate them for meeting those needs. So thank you to our community. Starting Sunday, Amarillo Public Health will not publish a report card on Sundays. The team at Public Health has worked 7 days a week starting March the 12th and only taking off Easter. It takes about half a day for us to gather the information for the report card. It is important for us to balance the providing information to our community while also rest for the team at Public Health. We appreciate your understanding, and there will be a report card each day, Monday through Saturday. Drive-through testing continues, provided by Amarillo Public Health and the Texas Tech Health Science Center. It continues today until 3 p.m. If you are symptomatic and need a test, please call 378-6300. This testing is separate from the Texas Military Forces testing. So this is the testing that has been occurring since the beginning. Our call takers will be available at 378-6300 and are there to screen and direct you to testing. So far, 3,089 people have been tested through the drive-through testing site, and we appreciate our partners, including Potter County, City of Amarillo, and the Tri-State Fairgrounds. Thank you, Jordan, or Dave. Thank you, Dave.
Thank you, Casey. At this time, we want to go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center.
Yes, good morning. Wanted to once again repeat that the only remedy for this COVID-19 is continue with social distancing, and please remember to wear a mask when you are out in public. That is helping protect your neighbor more than yourself. And please try to avoid congregating in crowds. To date, we have 29 individuals have received plasma transfusions. And we've had 4 donors, all of which are local as of this week. Just to expand a little bit about Mayor Nelson's, the statement I made a couple of weeks ago in terms of an old term we used in infection control. I've done infection control at both hospitals over the years. And the old saying is that if you have a 0 infection rate, you're just not looking hard enough. So you have to get out and beat the bushes and walk the halls because they're out there. And so I think it's on a larger scale, I think that's what we're dealing with here. We're going to find more infections, but we're out looking for them actively. And when we know that we have them, then we can act on that and overall reduce our mortality in the community. And that's the goal. Thank you.
Thank you, Dr. Milton. Now I want to go to City Manager Jared Miller.
Thanks, Dave. All right, if you remember, earlier this month, we announced a new emergency earlier last month, we announced a new emergency notification system to provide current factual information on a variety of events, including COVID-19. I want to encourage citizens to continue to sign up for the service at AmarilloAlerts.com so you can stay informed. As of this morning, we have 5,619 people signed up for the alerts. We also, last week, brought our biggest week testing so far at the drive-through testing center. We had 726 people tested. Additionally, the National Guard tested over 200 more individuals over the weekend. And then we've had a lot more testing this week as well by both the city and by the State Guard. The pet pantry, we also had over 792 people served this week at the pet pantry. It's going to be open again next week on Tuesday and Thursday from 3 p.m. to 6 p.m. at Thompson Park. I want to continue to voice my appreciation for Merrick Pet Care for their partnership and donating all the food necessary to provide the program. Like I said, well over 15 tons has been donated by Merrick Pet Care at no cost to the city or to the citizens. We also had a mobile food pantry, or we have a mobile food pantry scheduled for today. That mobile food pantry is put on by the local ag community, our High Plains Food Bank, Hillside Church, and they're going to be doing that Friday today. from 1 p.m. And they'll go as long as they need to donate over 2,000 packs of food. Packs are going to be given on a first-come, first-served basis, limit 1 per vehicle. There's 2,000 packs available to families in need. No verification will be required to receive food. Got to come in a vehicle, though, so that we can help maintain social distancing and so that you have adequate means to carry all the goods that are going to be donated at this. There's going to be over a dozen eggs donated by Cal-Maine Foods, a pound of cheese donated by Hillmar Cheese Company, 2 gallons of whole milk donated by NutriBlend, Sarah Farms, and Southwest Dairy Farmers, 5 pounds of ground beef donated by Cactus Cares and Cabinets Beef Packers, and 5 pounds of potatoes donated by Larson Farms. That's the pack that's going to be given to each person that comes through, to each vehicle that comes through this event. Really big event, and it shows a lot about what our community does for each other when we're in need. We also had a furniture donation drive held yesterday. This was done at the Civic Center, and this was done to help our homeless population. As part of the city's response to COVID-19, a drive-through furniture donation drive to help the homeless population took place yesterday at the Amarillo Civic Center. We did this because City of Amarillo's Community Development Department recently moved 60 individuals from the Salvation Army to alternative housing, such as hotels. The move, made possible through grant funds, helps provide adequate social distancing space at the Salvation Army. Individuals are in alternative housing to help ensure their safety, the public safety, and the safety of the individuals at the Salvation Army. The move was made necessary. The move made it necessary to provide furniture for individuals in those housing situations. We had a great response to donations. We had dressers, couches, chairs, lamps, pots, pans, dishes, microwaves, coffee makers, all the things you need to outfit a home. It was really a great effort from our community and from our team. We had a lot of donations from an estate sale business. We had a couple that went to Walmart and spent a lot of money and time bringing in brand new lamps, coffee tables, and other things. Another Chance House brought in 2 trailer loads full of stuff. The Salvation Army was there with their canteen truck. Carpet Tech and Bug Tech cleaned every piece of furniture before it was loaded into the warehouse. So it was a great effort and a great cooperation. It's also supported by over 20 city employees from a variety of departments. Finally, I want to go over some of the changes with the governor's order that took place both last week and today and going forward through the rest of May. Beginning May 1st, retail services were opened up to 25% of their listed capacity. That includes in-store retail services, dine-in restaurant services, movie theaters, shopping malls, museums, and libraries. That reopened services list expands today, May 8th, to include most notably cosmetology salons, hair salons, barbershops, and nail salons. So you'll be able to get your hair cut and get your nails done, which is something people have been waiting for eagerly. On May 18th, reopened services are going to expand again to include office buildings, manufacturing services, and gyms and exercise facilities. All of those up to 25%, just like in the retail services of their listed capacity. We are still directed to avoid visiting bars, massage establishments, tattoo studios, piercing studios, sexual-oriented businesses, interactive amusement venues such as bowling alleys, video arcades, amusement parks, water parks, or splash pads. That's all I have, Dave.
Thank you, Jared. At this time, we're going to open it up to questions from our local media. We have a question for an individual panel member or the panel.
For Mayor Nelson, how is the Strikeforce testing going so far?
I think it's going according to plan. And like I said, they processed several hundred over the weekend. And then they really got the mobile testing site set up on Wednesday for doing testing there at the facility. And 740 people tested on Wednesday. About 1,400 people tested yesterday. They're testing today, tomorrow. Casey, will they test on Sunday? I heard they thought they might need through Monday to finish up testing.
Yes, I think they got a little bit of a late start today just because of the weather. So it might, they may need to go into Monday.
Yeah, so they're going to have tested about 4,000 people at that mobile testing site by the time it's all said and done, which we could not have done without the help of those state resources. And I'm very grateful for how responsive Governor Abbott and his team, as well as the top personnel for Department of State Health Services and Texas Department of Emergency Management.
And Mayor Nelson, how long do you think they're going to be in the area?
Well, that is a good question. Obviously, until they finish testing there, so maybe until Sunday or Monday. And then we are currently just evaluating other areas of need while they're here. Do we have other areas? And that's a fluid situation. We're analyzing that right now. So it's possible they could extend their stay. And Casey, feel free to jump on if I missed any information there.
And this next question is for Casey. Have we got all the Tyson employees tested yet?
So that is that's what the Texas military force is doing now. So that's the work that is occurring right now.
And when will we start seeing those results?
I think, generally there's probably a 48-hour turnaround. We're working very closely with the state on that, but the state health department is processing all of that, and they will turn those test results around as soon as they can.
I thought it was interesting, Jack, again, just showing the responsiveness of the state. They are flying our test results to Galveston and also a second location. Casey, I can't recall what it is, but they're trying as hard as they can to speed up our turnaround time. And so they made available airplane service to get those results flown, to get those samples flown out so we could get results as soon as possible.
And are we, Casey, are we starting to see any data coming in from the increased testing of the National Guard and what the CDC is doing? And if so, is there anything surprising in that data?
So I think it's important to know the difference. So the state is doing the testing at the plants, and the CDC is doing assessment and the work where they'll be giving recommendations. And so there's two separate activities going on at the same time. And so it is hard to make sure that those two activities are separate, but they're very separate activities. And so, yes, so the CDC is doing assessments and will be providing recommendations probably over the weekend, early next week. The state guard is doing the testing, and we should be starting to see test results soon.
And I think it's interesting too that this is the first time we've walked through in our health department in this current situation using state resources to help us expand our testing. So this is, again, a fluid situation. So how we get that data back, how quickly we get it back, how it gets processed, all of those systems are being created as we walk through this process. So we appreciate the patience and the grace that citizens are going to give us. Right now, we don't exactly have visibility on what that's going to look like. We're hoping to get it back as soon as possible and process it as we've just been processing the testing at the Tri-State Fairgrounds. But this is happening in the moment. And so we're walking through it and hoping there won't be any problems getting that data posted so that we can keep people in the city informed about the status of the test results out there.
And Mayor Nelson, with the influx of testing numbers and possible increase in positive cases, is there anything you want people to know who will be seeing these results and the likely increases?
I want them to know that it's a good thing that we have actual data. And so increasing numbers, and Dr. Milton or Casey may speak to this too, increasing numbers shouldn't be what we're afraid of. And having good, better information about the status of the spread in our city is not something we should be concerned or afraid of. What we do with that data, how the strategies we make off of it, and how well we as citizens and business owners implement those strategies is only made stronger by having that data to form the strategy. So it will concern us as we watch our numbers go up, especially if we're comparing to other counties that probably don't have the same testing resources that we have. We are blessed in that we have gotten the support of our governor and the support of top personnel in the state to send us extra resources to do this testing. And not every county and not every city is in that same situation. So I think it is important for us to keep that perspective as our numbers go up and we watch our positive test cases continue to rise.
And are we going to be seeing any additional testing over there at the Clements unit? Do we know?
Casey, I know we're working on additional testing still in the city. I don't know about anything specifically at the prison.
No, we're working with each of our partners, but we don't have plans identified and laid out as to where that will happen next.
I'll state that I round daily at the hospitals, and Northwest receives all the individuals who get sick enough to where they have to come to the hospital. And so I'm in daily communication with the officers and the individuals that work there and keep a census ongoing. Those numbers have been pretty stable, and I've been in communication with the physicians, the regional director of that, over the last few weeks, and they are implementing and have been implementing a plan that's been in effect for almost a month there at the Clements unit. They do a lot of their testing, though, I think, and a lot of their treatment more internally. And so we have been in communication with them, and I'm confident that they are doing their very best to reduce COVID in their facilities.
Okay, I have no further questions. Thank you, guys.
Thank you, Jack. It's time we now want to move to Ariana Martinez, KFDA Channel 10. Ariana, how are you?
Good morning, everyone. With everyone getting tested at Tyson, is it the same with those? Do they have to be quarantined until their results are back?
No. So what they're doing is it's recommended that if someone is sick, that they not be at work. And Tyson has, they have been good partners. If people are asymptomatic, then they're not being required to be out of work until the results are back, because that would be their entire workforce. However, if someone is positive, then they are being required to isolate until the time that they would be released back to work.
Okay.
Really depends on whether they're symptomatic or not, right, Casey?
Yes, ma'am.
And when we do get those results, will it be part of Potter County or will it be separate?
It's based, so each test result is based on where the person lives, and so it's based on the county of residence.
Okay. And did we get the supplies like the ventilators from the state, or are we still waiting for the recommendations?
So we're still working through each of those pieces. We're still working through each of those pieces with the governor's office and their team.
And I would comment that the ventilator use in the hospital in both hospitals has been around 50% or less. And so there's not a need, and that's been true to say over the last several weeks, there's not been a need for ventilators from outside the community.
Thankfully, the list that we gave the governor last week was a very long-term list of what we thought we needed to address COVID over a longer period of time. Since we presented that list, then we have actually worked with state personnel to break it up into smaller chunks that better match what's happening in a 3 to 5 day window of what our actual situation looks like. And just like Dr. Milton said, as of right now, we aren't having any challenges on ventilators. We have had masks shipped. We obviously have had testing kits shipped, as well as hands-on to stand up an entire testing facility to test 4,000 people. So we have had a great response in resources from the state, and we were in ongoing conversation about that. They're daily looking at our ventilator use, and if we were to spike up for some reason and need them, I'm confident that the state would send them. The governor told me that personally.
Perfect. And with the age range of deaths now starting at 0, does that mean an infant or an unborn baby has died?
No, so the category for 0 to 19 is a very wide category, but it's so it means it also includes teenagers.
Okay. And when how will we find out recommendations of CDC and DSHS stemming from tours from meatpacking plants?
So those will probably start to be published this weekend and released early next week. And so we look forward to working with that team to see what those recommendations are.
Perfect. And how much have prison cases contributed to Potter County count?
So I can say overall count. I don't necessarily have it broken down by county, but at last week's count, it was around 8% was overall criminal justice numbers, was around 8%.
And how will the city be enforcing remaining requirements of businesses, and who will be monitoring compliance?
We've gotten a lot of calls from people wanting to report either good performance of businesses or bad. We've been investigating all of the reports of noncompliance with the governor's orders. We're doing that through environmental health and through the fire marshal's office. Every time we've interacted with the business on that, they've been very proactive or very receptive and modified operations to be compliant with the governor's orders. So we are responding to all complaints. We're also proactively going out and visiting with businesses. And we'll be meeting with businesses if they'd like to discuss how they can best meet the requirements of the governor's orders. So we've had a lot of interactions with businesses so far, all of them positive.
Perfect. And this one probably will be when we get those recommendations, but do we have any specifics on the buses transporting workers to JBS yet? Any changes?
No, they're working with them. The CDC is working with them. And we're looking at some options there to modify their operations, but they have been putting into place protocols with the buses themselves, working to monitor the number of people that are on each bus to better distribute those to maintain that social distancing.
Perfect. Thank you, guys.
Thank you, Ariana. This time we now want to go to, if I'm not mistaken, Roger Gray of KVI Channel 7. Roger, how are you?
I'm good, guys. This is for Dr. Milton. Dr. Milton, in addition to the issue we have being so close to multiple packing facilities and so forth, we're also by the governor's orders on what will open and he's privately admitted this will increase the number of cases. I presume that's a concern for you as well. And here's a chance to make your precaution pitch. Is part of the problem that too many people still don't take this seriously enough?
So that was kind of a complicated question, but it sounds like, I mean, to break down the numbers, as Casey's kind of alluded to over time, you know, if you add in the TDC and the packing plants, that's about 50% of the cases are related to those facilities. So, you know, the way we've always looked at this is that we try to identify the vulnerable populations. So clearly those are vulnerable populations, and we want to have our finger on the pulse of that, those places more so than any other place. And so those are is there something else about your question that I could help with? What's your question?
As mentioned, the governor's already admitted privately that he knows opening as we are opening businesses is going to increase the numbers, just inevitably. And I just presume that's a concern for you as well.
Yeah, well, and of course, you know, what's helpful is that we're going to do a whole lot of testing. And I think that our goal here is, and I think elsewhere, is always to make sure that we're not overwhelming our hospital capacity. And we've held pretty firm with that. And I think doing the extra testing helps that, because we're able to identify further hotspots and then hopefully with contact investigation, isolate those individuals. So that's been the strategy all along, as far as I'm concerned, is to do as much testing as possible and then try to have a small army of people that can do the contact investigation and get people to comply with their social distancing.
And I've heard you say that over and over again, Doctor, that really it comes down to how our distance from each other, just how we can create that distance between each other, wearing a mask and not getting out, or at least staying 6 feet away from each other. That's going to really be the most important component of how the disease spreads through our community.
Sure, and it's a personal choice. It's not something that, is laws or rules. I mean, this is something that we need to do on our own and alter our behavior.
And knowing every time that you are in a large group, that risk increases.
Sure. I mean, you can look at the hot spots we've had. As we've said all along, there are always places where people congregate. I think also people's behavior when they congregate is important. As I mentioned before, there was an event in Washington State where a choir group got together, and probably just the act of singing in close proximity to each other increases the risk of spread. Another example would be the basketball tournament in early March. What do people do when they get into a basketball tournament? They are close together and they're yelling and hugging. So it's the behavior, I think, that also has something to do with this as well.
I guess that was the thrust of my question. Does it concern you that we're not taking it seriously enough? And as you walk a town and go shopping in a store and you see people not observing those protocols?
Yeah, so, I think the biggest concern I would have is that I would really like people to change their thought about wearing a mask. I was visiting with a healthcare provider in the doctor's lounge the other day. He happened to be Taiwanese, and he stated in their culture in Taiwan, it was actually considered somewhat offensive if you were to get in a public place where people congregate and not wear a mask. So it was their etiquette that was so different from ours, and I wish that we could adopt that because I think that's really important in reducing the risk of spread.
Okay, thank you.
Mm-hmm.
Thank you, Roger. Last time we want to move to David Gay of the Amarillo Globe News. David, good morning.
Morning, everybody. Just a few questions. First off, just a clarification. I don't know if it was on my end or a signal or something like that, but for Mayor Nelson, during your statement, how you stated how big the group, the Strikeforce from the CDC is. How many people is that? I think I missed that.
Casey, is it 5 people?
I think 5 or 6.
That's 5.
There was initially 5. I believe a couple more landed on Monday or Tuesday.
Okay, I just wanted to make sure. I think it kind of spritzed out on me at the beginning. I guess my second question is regarding the drive-through testing center. I guess with the addition of the tests from the Texas National Guard, has that changed anything regarding the turnaround of tests for the drive-through testing center that members of the community can go to?
So there's separate testing capacities, and so the testing that was done on Saturday and Sunday was done through the Texas Military Force, and so those test results will come back through them. The testing that is done through the Monday through Friday testing site at the fairgrounds that's provided through the Amarillo Public Health Department and Texas Tech, that process is still the same. And so those test results will come back through the Amarillo Public Health Department. And so that process won't change.
Yeah, and they're going to different labs. The state tests are going to different labs than the city tests are going to. So the increased testing from the state won't slow down the return time for the city tests.
Okay. And
can y'all clarify? Sorry, pardon me, David, just a minute.
Well, no,
the name of the people that are operating that mobile test site at Tyson, is it Texas Military Force?
Yes.
Okay, thank you.
All right, sounds good. Thank you for the clarification, Mayor. And I guess the last thing is, I mean, with the request of increased supplies from the state, does that mean that the drive-through testing facility is good to go for the near future for the community to be tested?
That's a good question, Dave. So we're working with the state hand in hand on that. So right now we will be good to go next week, and then we're continuing to work with them on supplies. And so we're hopeful that that will continue for the foreseeable future. But right now we are working with them consistently regarding supplies, and they have assured us that we will have supplies.
And I think to clarify more, I'm not sure if you were asking if we were going to do asymptomatic testing through the city. We're not. We're going to stick with symptomatic testing as we have been, where you call in to the public health department, they do the phone triage, and then send you to the testing site if you meet the criteria. The Texas military forces are doing asymptomatic testing at the plants. So that's the reason for the difference in how a test, what you do after you take a test is for those. That's why those people are still going to work. But if you come to the city, you're already symptomatic. So you're directed to isolate until you get the results.
Absolutely. Absolutely. Thank you, guys. I appreciate it. Stay safe.
Thank you, David. That concludes our news conference for today. Once again, we do these every Monday, Wednesday, and Friday at 11 a.m. for the latest in COVID-19 information and updates. This is David Henry. I'm Communications Manager for the City of Amarillo. And we'll see everybody next week. Thank you.